This is the Celiac Project, two guys talking gluten-free. Just wanted to give a little disclaimer. We are not medical experts, doctors, dietitians,
Nurses.
bone experts, surgeons.
We're only experts at being celiac patients.
So enjoy the show. And if you're going to do any changes to your diet or need real medical advice, please go to the medical professionals.
That's what they're there for. We have an amazing treat for you. If you want to listen and watch this week's episode, you can go to youtube.com/@celiacproject and watch it there.
If you prefer, you can listen as you usually do. We hope to have some of our future shows on video as they are available, so look for that as well. Now let's get to the show.
Sounds good.
Today's episode of the Celiac Project podcast is sponsored by Taste Republic, who believes everyone deserves to eat good, fresh pasta, no matter their dietary restrictions. All of Taste Republic's pastas are certified gluten-free and beloved for not sacrificing taste or texture. With fan favorites such as 4-cheese tortelloni and cauliflower linguine, Taste Republic has a wide range of pastas to choose from. Find Taste Republic at retailers such as Meijer, Publix, and Target, or online at tasterepublic.com. You found the Celiac Project podcast, two guys talking gluten-free. I'm Mike.
And I'm Cam.
And who's joining us on the podcast today, Cam?
Today we have Dr. Deanna Kelly.
Deanna is a tenured professor of psychiatry at the Maryland Psychiatric Research Center, University of Maryland School of Medicine, and she is co-author of the new book, Get Your Brain Off Grain. Let's get to the show.
Sounds good.
Cam and I are so excited to welcome Dr. Deanna Kelly today to the podcast. How are you today, Deanna?
I'm great. Thanks so much for having me.
Yeah, we're really excited to get into this today, hear about your new book, and talk to you about a lot of the incredible research you've been part of. Before we get into any of that, can you give our listeners a little bit about your background and the work you do?
Sure. So I'm a professor at the University of Maryland School of Medicine in Baltimore. I've been there for 28 years, and I'm also the director of a research center called the Maryland Psychiatric Research Center. We have been dedicated, and I've been working most of my career looking for new treatments for people who have severe mental illness, doing clinical trials. And my background is actually in pharmacy. So I have a doctorate in pharmacy, and I'm board certified in psychiatric pharmacy. So that's why I got into the mental health field. But along the way, and you'll probably ask me these questions, but along the way, I sort of got into some treatments that were less mainstream, not all medication treatments, and looking at dietary interventions in treating people, but then understanding the link between diet and mental health has been a huge part of my career. And I'm excited to talk to you about that.
And how did you get interested in that type of work? Like what led to your jump?
Yeah. Well, early on, I'm working with a lot of people with severe mental illness, and all medications that come to market really are for everybody. Like we all should be treated the same. That's how medications sort of are tested. And we started to understand that people have very different underlying like biology and pathophysiology, like different underpinnings of why they might develop mental health conditions. And so we found some groups of people who had immune responses or had autoimmune disorders, et cetera, and realized that this group of people might be treated differently because we might have inflammation and immune responses that are different because of their autoimmune diseases. So I started looking at the connection of the immune system to psychiatric symptoms, maybe like 20 years ago. And gluten was one of the first things that we were looking at. When we found that people were having an immune response to gluten, it shocked me. Like I was like, what does this mean? And so I've collaborated with people like Alessio Fasano, who was at Maryland. He's at the Harvard Celiac Center now, who actually taught me my initial like foray into like this work. But we had patients, and so did Dr. Fasano, that had mental health conditions and was linked to either celiac disease or non-celiac gluten sensitivity, for example. And that's really 15 years ago or 20 years ago, I would have laughed if you would have said I would be in this space. But now I understand that the gut and the brain are connected, and celiac disease is related to mental health conditions for sure. And that's kind of where we've been. And I've been on that path ever since.
That's really exciting that you've been doing that, because when we hear that you found that connection 15, 20 years ago, it's such a relatively new thing that people understand that. So that's really exciting to us. And wanted to ask you, I see you've done some really interesting research about the connection between depression and celiac disease. Can you talk to us a little bit about that?
Yeah. So, and we come back to like the book that we've just published in a little bit, but I like to put together the evidence base so that people understand like really what this connection is. And that's one reason we wrote the book that we did. But we have chapters in the middle of our book where we like summarize all the literature on depression, summarize all the literature on anxiety, ADHD, for example, but all the mental health conditions have some linkage to gluten and to celiac disease. And in particular, depression is quite common in people who have celiac disease. I don't people realize it. I mean, you have was astute following that are much more savvy and understanding and training in celiac disease per se. I mean, I'm coming in from the mental health side and learning about this connection and studying this connection. But we definitely know that depression is higher in people with celiac disease and people with non-celiac gluten sensitivity. Maybe it's upwards of like 60% of people have depressive symptoms. We do know that there's studies out there that show, and this isn't from my work, but it's from others, that depressive symptoms can improve in people who have celiac disease when they are on a gluten-free diet. Maybe not everybody's, but some people can, if they're under control, can improve their depressive symptoms. And then there's studies to show us that if you introduce gluten back in, depressive symptoms can get worse. So in these stringent studies where it's blinded and you take gluten and you put it in, you take gluten and put it out and you measure symptoms, you can see depressive symptom scores and ratings change with the amount of gluten in the diet. So it absolutely is a connection. And you probably have followers and people that follow along that do have psychiatric symptoms and said, but I didn't realize that potentially these were related. And I think that's where the connection, putting this all together, that's where the connection is, that people don't understand that their mental health might be related to their underlying disease state of celiac disease.
And I think that's a great lead in too to how did you get your book, Get Your Brain Off Grain? How did that all come about?
Yeah. So since we've been researching this for so long, and it just was hard to get sort of mainstream attention to this fact. And what I was understanding, what I was seeing is that gastroenterologists, when they're looking at celiac disease patients and gluten potentially, they were not connecting to the mental health and psychiatry field. And then in our field of psychiatry, we were not connecting to the gastroenterology field. And so when I started screening people, I've screened over 1,000 people, healthy controls and people with mental health conditions, to see if they have antibodies that suggest celiac disease, like tissue transglutaminase, et cetera. And then, what's fascinating is I find people that are positive for these antibodies and they don't know it. And they said, oh my gosh, I have a lot of mental health issues. I have joint issues. I have cognitive and fogginess, brain issues. I have a little bit of stomach issues, but they don't realize that everyone out there outside of your field thinks that celiac is just the gut, right? We all think that it's just the gut. And, like I started to learn, well, it's not just the gut. And in fact, it may not always be the gut. So the brain is involved as well. And so we wanted to put this information together. And I was getting calls and emails from families and physicians across the country saying, my child has depression or my child has this. And I think that it might have something to do with gluten. It's worse when they eat pasta, or I hear things like that. But my doctors don't want to think these are connected. And so I finished 3 clinical trials. Now I've published maybe 25 scientific papers in this space, but putting that together with all the other literature that's out there and connecting to a psychiatrist who herself contacted me because she had non-celiac gluten sensitivity or celiac disease. She's not entirely sure. She hasn't actually been tested, but she had severe panic disorder and anxiety. And when she was on a gluten-free diet for a while, she actually had resolution of those symptoms. So she came to me. So we put together this idea that we need to get this out there. Like, people need to understand, and it coming from both ends, right? Like, if you have a mental health condition and you don't have any sense that this might be related to gluten, this might help your doctor understand that. You might be able to talk about it or bring attention to it. Or if you have celiac disease, for example, and you have anxiety, et cetera, you might sort of understand that that's related to the illness and not necessarily a different entity all in itself. So we thought that the world needed this data to be at the forefront, to be needed in mainstream attention. So we all came together and put this data out there.
It's very exciting. I mean, Cam and I are always excited when we have guests like yourself, because as we were alluding to at the top of the podcast, we feel like this is like a subject that we really need to dive into and find out more, because it does seem like there is such a connection between the mental, emotional side of things. And so, like, bigger picture, are there specific psychiatric conditions where you think screening for celiac disease should be considered more often? Or do you have examples in your own work and studies that show that that might be a positive thing to do, to test more for celiac with certain psychiatric conditions?
Yeah, no, that's a great point. I mean, I wish we were further along in the connection of the fields to be able to say that, gold standard recommendations are we should be screening. Well, I wish we were further along there. We're not quite there yet, but I certainly think we'll get there. And I think, for example, in diseases where people have new onset, like depressive symptoms or schizophrenia, for example, in the work that I do, if we would screen in some of our young patients, newly diagnosed, for example, if we could potentially be treating them earlier on and have earlier interventions, we might actually lead to better long-term outcomes. So early intervention is going to be so critical to long-term outcomes. You could imagine if your brain continually has inflammation for a long period of time, how much harder that is. And we see that with like gluten ataxia, for example. We know for sure with gluten ataxia, which is one of the neurologically connected to gluten in some people, the longer you go without removing gluten, the harder it is to actually regain stability of not having these ataxic or off balance symptoms that might happen. So early intervention is going to be key. I do think we'll get there. Our research is trying to push for younger patients to be tested, but I think that's important to have clues. Like it's important to have clues to talk to your doctor about since screening is not routine. I think it's important if there's celiac in the family, if there's GI issues in the family, if there's other autoimmune conditions, hypothyroidism in the families, if you see any worsening when you certainly are in periods of not having gluten or not. There certainly should be times where there's red flags right away where we say, you know what, I need to talk to my doctor, I need to talk to my provider about this and bring forth the idea that maybe I should be tested for celiac disease. And in fact, some of our data shows, like I told you, that we found when we tested people who had some of these mental health conditions, they were testing positive for tissue transglutaminase, possibly having celiac disease and not knowing it. Upwards of like 3-4% of people were not even ever been diagnosed with celiac disease. So like you all know this, that there's people out there with celiac disease that don't know it. And the mental health as a clue to having celiac disease is not well known. So I think that if you have that and there's other clues, it might be a red flag to say, let's get tested for celiac disease.
I was curious too, maybe you've noticed it in some of the research you've been doing, and you kind of mentioned it a little bit earlier, but in a different context. Have you noticed the burden of celiac disease and the effect on mental health conditions? I know you had said how the depressive symptoms were reduced once people went on a gluten-free diet, and that wasn't always the case. And I would assume in those situations where it's not always the case, potentially the burden of the lifestyle is what's still maybe keeping them depressed. But I was just wanting to know any insight or correlations that you've seen or noticed.
Yeah, no, you certainly hit, the nail on the head there. We do comment in that in the book because there's the thinking potentially that depressive symptoms are part of the illness. But as you know, and as your listening body knows, it's hard to maintain a gluten-free diet. People do well at it and this is their lifestyle now. People have to do this, be on a gluten-free diet. But knowing that you have to do that can lead to anxiety for going out, depressive symptoms. And so there is recognition of that. However, the literature that's out there does pinpoint there's more data to suggest that the underlying depressive symptoms are part of the illness more so than related to the lifestyle. But you certainly are right. Like it is tough for people, and having to do that can lead to additional psychiatric symptoms of it itself. If that was sort of your question, I just wanted to point that out because it's worthy of noting that there is literature on that. That is a real thing, to think about.
Yeah, and luckily it seems like they're studying the hypervigilance part of it. We've talked to some researchers who are getting into some studies about that. So hopefully there'll be more information on how much that leads to depression and some other things like that.
Yeah, I think that's important. There's people working on that for sure. Yeah.
And so have you seen improvements in mental health symptoms once someone goes gluten-free? Like with people with schizophrenia and other things, have you seen large improvements once they go on the gluten-free diet?
Yeah. So in my research in particular that got me started was in the area of schizophrenia. And so I'll comment on that first. There's celiac disease. And then what we have also been studying, I think what the world sort of calls non-celiac gluten sensitivity, but we were looking at a subgroup of people who had antibodies to gliadin. So like the protein found in gluten, they're having an immune response to that. And what we saw too is that this is showing up on blood markers, but also we do brain scans. So I can see correlations between what looks to be brain inflammation in this subgroup of people. So probably the same is true for celiac disease, that we're having inflammation in the brain in this subgroup of people. And when I do my gluten-free diet studies, particularly in the subgroup, so this could be true for celiac or those with this immune response that we're studying, when you treat it with a gluten-free diet relative to a gluten-containing diet in our double-blind randomized trials, we can show psychiatric symptoms get better. It's particularly in the area of what we call negative symptoms. That's like their motivation to do something, to the social interactions, somewhat similar to depressive symptoms, like your drive to sort of interact and get pleasure out of things, somewhat similar to that. So we see those improvements. But I can look at brain scan data, and this is blinded to the condition, not knowing if this is gluten-free diet or gluten-containing diet. And I can see changes in blood flow in the brain with improvements in blood flow in the brain in the gluten-free diet compared to the gluten-containing diet. So, we have data, not only subjective data on their symptoms, like do their psychiatric symptoms get better, but actually actual quantification in the brain when you measure changes in blood flow and you can see differences. And so I think that's pretty powerful to show us like how impacted the brain is. And then by just removing gluten, how much change the function of the brain can change. So I'm talking about that in schizophrenia. It's likely true for other disorders as well. But Dr. Hellings, who's one of the co-authors of the book, she treats people with autism, ADHD, and she has, seen improvements in people. We don't suggest that every person who has a mental health condition is going to get better with a gluten-free diet. Certainly if you have celiac disease, we would hope that you would, and a gluten-free diet is indicated. But when I talk about this subgroup of people with these antibodies to gliadin, like this non-celiac gluten sensitivity group, for any of the listeners out there who don't have celiac but are interested in this gluten reaction, we certainly think that that subgroup of people have a really good chance of responding to their mental health conditions. Yeah.
That's great.
Hey, Mike, I wanted to take a minute to talk about our sponsor, Taste Republic. Taste Republic was founded with a singular purpose, and it's one that they have not swayed from, producing high-quality, fresh, gluten-free pastas.
Yeah, Cam, and what's really cool was how it all started. One of the Taste Republic co-founders was selling traditional pasta at the local farmer's market, had a loyal customer diagnosed with celiac disease, and was upset that they could no longer eat the pasta.
And with that as the driving force, he set out to develop a recipe that was gluten-free, yet matched the taste and texture of traditional pastas.
Yeah, and the wild part is that Taste Republic really pulled it off. They still operate under the idea that everyone deserves to eat good pasta no matter their dietary needs. They continue to develop some of the best gluten-free pastas available, like their famed 4-cheese tortelloni.
The best part is you can find your favorite Taste Republic bag of 4-cheese tortelloni or spinach and cheese tortelloni at retailers such as Meijer, Publix, and Target.
Check out all their delicious pastas at tasterepublic.com, where you can use their convenient store locator to find them locally or purchase online. Now let's get back to the show.
Sounds good.
And so for patients with celiac disease, we've been talking about depression and anxiety a lot. Are there other treatment strategies or supports that you find effective outside? Like, let's say they've gone on a gluten-free diet already. Are there other things that can be effective?
Yeah, it's a good point. So, I'm a psychiatric pharmacist by training and board certified in that. And my specialty is understanding psychiatric medication. And so there's no reason to suggest that people with celiac disease might not respond well to psychiatric medications. But certainly there are cases, and we put them in the book, of people who are treatment refractory, who have celiac disease and have not responded to antidepressants. And we have cases listed. People can respond, so we should be getting treatment. If you're not getting better on your gluten-free diet, your psychiatric symptoms, people should be seeking care, like breaking down stigma, talking about it, making sure that your depressive symptoms or anxiety are treated. I mean, lifestyle is important, good sleep habits. There's lots of things that medications can play an important role. But if people are refractory to the treatments, often it's because I noticed they haven't been diagnosed with their underlying, or they haven't on a gluten-free diet. And when they can go on a gluten-free diet, then you can start to get better. And then the medications can come along and help as well. But there's no reason to suggest that most people wouldn't do well on medication treatments. And I think medications can have a good role if we need to use them for sure, looking out for side effects, making sure that we manage and get people on the best treatment for each person. But yeah, antidepressants, anxiety, other new treatments on the market. I think lifestyle is important. Celiac, of course, this is a lifestyle, but other things like sleep hygiene, good nutrition overall is important. But yeah, medications can be a cornerstone to recovery as well.
And then I also wanted to ask now, with all of this very exciting research, do you have something that's next on your horizon that you're looking at, or do you have other questions that showed up now through your new research that is your new question?
Oh my gosh, we have lots. So it's like you learn one thing and then you learn that you don't know 100 other things. So, for example, I'm trying to understand about why is this subgroup of people who have mental health conditions have this gluten sensitivity? Not everybody has celiac disease. And so why do they have it? And we have found recently that this is related to potentially, there's two things we found. There's T cell dysfunction. It looks like people who have, psychiatric illness might have different types of T cells in their body that cells have not transformed in the right type of cells, this immune dysfunction that's happening. So we're studying this full, why is this happening? What is going on? What's different in this group? It's something, it's causing psychiatric illness, but it's also something to do with their immune system dysregulation. So if we could understand that, we might be able to prevent people from having psychiatric illness if we could find out this dysregulation and treat this very early on. Maybe it's genetic, maybe it's not. So we're looking at that. We've also looked at this idea of mimicry. Gliadin itself, the protein, has a very similar structure to a receptor in the brain called the glutamate receptor. Their overlap of their protein structures, about 70%, our body might be mistakenly seeing that as gluten. Like the body sees gluten, creates antibodies, wants to fight it off like an infection, and then sees the receptors in the brain and might actually. So some of the mental health and psychiatric illness that might be related. We've actually looked at antibodies to the receptor in the brain, the protein created, and we've seen that that's higher in this group. So something's happening on this mimicry idea. So we're starting to study that. I'm also understanding the power of nutrition in psychiatric illness more. And so while I started off with all medications, and again, I'm a pharmacist, medications are really, really important. I'm currently in the space of looking at ketogenic diets and how that might impact people who have mental health conditions as well. Like there's mitochondrial dysfunction, et cetera. And so we have a lot of we're looking at the gut to the brain. We're understanding how does this all impact the gut microbiome, the bacteria in our guts, and how does that then impact the brain? All this is, relevant for celiac disease as well. So yeah, I have a lot of things we have going on. We're looking for trying to get funding in this space, from NIH and other institutes and philanthropy to try to keep our studies going. It's tougher right now with grants not as easy to get as before, but these are all things we're looking at and a lot of great questions to answer.
Awesome. No, that's all very, very exciting. And you actually reminded me in your answer, I had another question. Is there, and this may have been answered in a past podcast, but I can't remember for the life of me. Do celiac patients have any issue absorbing medications? And then could that be a reason why some of the medications didn't work for some of those celiac patients more early on?
Yeah, no, that's a great question. I don't know that for sure. And I think that there's certainly that, you definitely know that in the field where, vitamins are not absorbed, some of the important vitamins and minerals that are needed. I do think that there's some changes in the absorption of some medications. There also is potentially metabolic changes that might be happening on how people metabolize medications differently in someone with celiac disease. And so I don't know for sure. I don't have the numbers in front of me, but how, when you think about medications coming in, they have to be absorbed, in most cases, absorbed from the GI tract. And that's the rate limiting step to once it gets into the body. So if you had people speak on this before, if you're having very low absorption, you have to have very high doses to get to the same concentrations. And so if there's villi damage, gut damage there, but also you're looking at potentially gut permeability issues or other things are getting through that shouldn't too. And so I don't have the numbers offhand and don't know all the literature around that, but I suspect that the absorption issue can be a real challenge in trying to reach important peak concentrations of medication, especially with severe villi damage in the gut.
Definitely. No, I appreciate that.
Very interesting information. I have sort of a two-parter for you. So what could you tell people with celiac who are trying to advocate and maybe having a hard time getting some support for their mental health issues that may or may not be celiac related, like how to sort of advocate for themselves? Because I know hopefully the medical community is catching up and understanding, as Dr. Fasano has said, celiac disease is a chameleon. You have psychological stuff, you have bones and joints, and of course your GI system as well. So how would you tell someone to maybe advocate for themselves? And the second part of that is, do you feel like the medical community is starting to catch up and understand the whole systemic nature of celiac disease?
I'll start with the second one. I do think the field is moving ahead in the recognition. Like I said, I've been in this space for 15 to 20 years. And like you said, nobody hears about this work because like our work gets buried in journals. Science takes a long time to catch up to real world clinical care. And we have so much we don't know. But I do think that it is really important to advocate for yourselves. And I think probably many listeners on here, that's what they've done throughout most of their lives is, trying to figure out and get to their diagnosis appropriately. Because, we all have had stories where it just like it was provider after provider, we could not figure out what's going on. And that's not just only true for celiac, but other things as well. But I think it's important to talk to the provider because if you're going in with celiac disease and you're talking to your GI, they're not so much all the time going to be listening about, your anxiety and your depression. And I think it's great to speak up and say, hey, look, I recognize that this is growing field and these are connected. Like, how can you help me address this? And like, I think we call that out. We make us all as providers accountable to like think about things outside of our just little world. I mean, same is true in psychiatry. Someone comes in with a psychiatric complaint, like depression, et cetera. And you say, like, I recognize that I have a lot of GI issues and this might be related, and challenging them to even take the book if you need to take the book and say, here's the connection. Like there's 300 references. How can you just use that, that idea? But we have to continue to call out the field to make sure that we advocate, that we bring voice to our own healthcare. And I go back to the story, like my son had a brain tumor, unrelated to this, but I had to fight as a mom to say, hey, look, can you look at this? Will you look at this? I, don't know all the answers. I know you don't either, but this is probably related. How can we think about this better? And, people then listen because they realize that these things are all connected. We want to get to the underlying. So I just think that advocacy, talking, bringing it up and breaking stigma, like it's okay to talk about depression. It's okay to talk about anxiety. And you start to see that your healthcare providers do make referrals, then they do try to connect you. And when they talk, we all win, right? Like they're all talking about this together and not in isolation. But I don't have there's no right answer. There's no like magic thing, but I just think that having the conversation is super important.
Yeah, we all have to sort of advocate for ourselves and become partners, I think, with our doctors. So I think you got the right answer in my book. And Deanna, this has been so much fun talking with you today. Wanted to give you another chance to tell everyone where to find your great new book. And also if there's anything else that we didn't get to today that you'd like to share with our audience.
No, thanks so much. Yeah, our book is called Get Your Brain Off Grain. It's actually available on Amazon. There's 3 authors. There's Dr. Hellings, Sharon Pugh, who's a nutrition specialist and a physician assistant, and then myself. So we have a multidisciplinary team that put this together, thinking about it from different aspects of care. We actually worked with gastroenterologists and immunologists to kind of make sure that everybody was reviewing what we were writing and putting this evidence together. But I think what it does is that it hopefully tells the story. And it allows you to see why this is connected. What's our theory around this? And what's the literature say? What is the evidence base to put this together of why the brain's connected? And then it gives you that sort of foundation in lay terms to understand what the connection is. And then the middle of the book kind of goes into, well, here's the evidence on depression. Here's the evidence on anxiety. Here's ADHD. So you could read it as a like choose your own adventure. You don't need to read through those chapters like a novel or something. I would go through them like, okay, this is what's important to me. Here's why I bought the book, because I have some related to someone with depression, or I have anxiety, or my child has ADHD, and maybe just touch upon what you need there. The chapters are there in the middle give the literature, but it also gives case reports. We give cases so people might identify and say, that sounds like me. Maybe I should talk about this a little more. And then the end of the book, we kind of go into the things that you all in the field of celiac disease know, like how to recognize hidden gluten, all of these things, that some of the new people that might never have come into the space don't know. And we end with international like travel and recipes, et cetera. But I think there's a lot of good information in there that you can pick and choose. That really appreciate people, taking a look at that and making that connection. But I think that if anything, the book will help you be able to talk to your practitioner and say, hey, look, this is not in my head. This is a real thing. And this is a time for us to start having this conversation. So that's what my hope is. And our hope is as a author team that people will find many parts of the book very useful.
Yeah, very important book. So glad that you put it out there, and really everyone should go check it out. And Dr. Deanna Kelly, thank you so much again for joining us today.
Thank you so much for having me.
Thank you for joining us. We really appreciate it.
Thanks for listening to today's show. If you like the podcast, please consider leaving us a 5-star review on Spotify, iTunes, or wherever you listen to the podcast. This will help other people find the show. Thanks so much, and we'll see you next time.
See ya.